Hi, my name is Dr. Chris Kolb. I'm a physical therapist here at Bo Jackson Sports Medicine. I'm going to be talking today about short and long-term overuse. So believe it or not, the number one case or cause of shoulder and elbow injuries is throwing too much. These injuries can happen either short-term or over the long term. We're going to kind of talk about both and describe each one a little bit, and then give some guidelines for how we can avoid these things and happening throughout your season. One study showed that 85% of high school pitchers who underwent Tommy John surgery reported a history of annual, seasonal, or single game overuse. So that definitely is a common theme in these shoulder and elbow pathologies, is the overuse of throwing. Also, playing catcher when not pitching can also lead to overuse and increase your injury by 5 times. So again, any repetitive throwing motion, this accumulation of stress, is going to increase your risk of injuries. So let's look at the short term first of all. These are things that are going to happen kind of immediately. So in the short term, every 10 pitches thrown can increase your risk of injury by 6%, according to some of the studies and the research that we know and that's out there and it's been proven. Studies have also shown that among youth and high school athletes, after throwing more than 50 pitches, we start and can see physiological changes in the tendons. So things start to occur immediately with throwing more than 50 pitches, and throwing even more, over 75 pitches, can significantly increase your risk of shoulder and elbow injuries by 50%. So again, in the short term, to reduce these things from happening, the biggest thing we can do is try to follow pitch count. So USA Baseball has definitely developed pitch counts. The chart here provides a good reference for you, looking and describing pitch counts for age groups, and then also the rest periods that occur after that. So one of the things to consider too is, again, we focus on pitch counts in terms of how many pitches are actually thrown during the game, but we really also need to consider bullpen throwing and warm-ups between innings as well, because again, a pitcher that might pitch 5 innings could end up, if we count all those other throws, increasing their total number of throws anywhere from 40 to 50, maybe 60 additional pitches. So this is something we need to consider when we consider recovery, rest, and the actual amount of stress that's placed on the throwing arm. So if we look at long term now, these are things that are going to accumulate over obviously a longer period of time. Studies have shown that major league pitchers who underwent Tommy John surgery often exceeded pitch count recommendations when they were in Little League. Studies also show that youth pitchers who throw more than 100 innings a year experience more injuries than those that don't, or throw less. Another example of effects of long term, we've seen the UCL, or the ulnar collateral ligament, with excessive pitching in terms of, let's say, 67 pitches per outing, 5 innings per game, and having a pitch history of about 5.5 years can lead to thickening of this ulnar collateral ligament. So that thickening can increase stiffness and increase your risk of injury and possible rupture of that particular ligament. Lastly, youth pitchers who don't take a break from throwing and throw more than 8 months of the year have a 500% increase in risk of injury. So how do we address this? Some simple guidelines we can provide for you. And again, these are all things that, again, you can do and you can have control of. So basically know what your season is, know when you're going to be playing, and know when your off season is. So then you can take advantage of that off season and plan for doing the proper things in the off season to help protect your arm and take care of decreasing your risk of injury. Take this time to, again, allow time for your injuries to heal, address your strength deficits, work on conditioning, and consult with your sports performance and sports physical therapy staff to help you kind of with those particular issues. Make sure we're getting a preseason screen done. This will help identify risk factors, imbalances, things we might not even know that are there, that we can then address and help prevent some of these injuries from occurring. And basically, most importantly, adhere to the throwing program that you're given by the Bo Jackson staff. And then during the season, one way to drastically reduce our overuse is to play positions that don't require you to throw as much. Catchers throw the ball just as much as pitchers. They don't throw as hard, but they do throw it just as repetitively. And again, a lot of these have to do with the overuse, the repetitive nature of the throwing motion. So keep that in mind. Also make sure we follow pitch counts that have been established by PitchSmart USA Baseball. Another recommendation is in the off season is to play different sports. This helps you be a better athlete. It helps you develop skills that are going to complement and allow you ultimately to be a better baseball player. And if you do decide you want to play baseball year-round, on the off season, work on other things. Allow your arm time to rest, work on your hitting, work on your fielding, working on your base running, and then also use that time to get with a certified strength and conditioning specialist to help increase your strength and conditioning levels to make you a better baseball player and protect your arm from injury. Thank you.